Good afternoon, everybody, and thank you for joining us for Grantham's Career Booster webinar series. Today, for our Academic Insider presentation, we're going to be talking with the College of Nursing and Allied Health. My name is Jeremy Bell, Career Services Manager, and I'm going to get this started. So, some areas that we're going to focus on today are going to be degree programs and the student academic experience within the College of Nursing and Allied Health, how you can apply that education to the workforce, and any other related activities that will be beneficial for you as you pursue your education and even once you have graduated. So I'm going to introduce today's moderators. First, we have Raylene Jones.
Hello, everyone. It's great to be here today.
Thanks, Raylene. Great to have you. And also joining us, we have Doug Dimler.
Hello, everyone.
And our special guest today is Cheryl Rules, PhD, who is our Dean of the College of Nursing and Allied Health. Welcome, Cheryl.
Thank you. I'm happy to be here.
Awesome. So let's go ahead and get started with Doug's first question.
Sure. My first question is, how much time is spent in Grantham's curriculum with the facility, talking to our students with the next step beyond their education?
That's a good question, and it's actually something that's often overlooked, I think, in many programs at all different levels, because you're focused on what you're doing now. However, one of Grantham University's core professional competencies is career management, and so we address that core professional competency by focusing in many areas of the curriculum, both in the nursing and the allied health side, on what's the next step. You know, we firmly believe that, especially in healthcare, but really in all areas of academics, your career needs to be managed. It needs to be carefully planned and thought out. Yes, there are going to be potholes in the road and your path as you go through it, things that you didn't anticipate. But it needs to be managed, it needs to be thoughtfully planned out, and students need some guidance as to what should their next step be. And so we actively discuss that whole process of creating your career path in the courses. We have, again, as you are aware of, student advisors, faculty advisors, we have mentors that can help students with that. For instance, one thing that we really try to promote is the pathway that's very clear in allied health. And it's rather unique in the field. There aren't a lot of schools, and we have the School of Allied Health that actually is planned in a stepwise manner. So a student can come in, let's say they're just out of high school and they just have a high school diploma or a GED, or they can come in because they're a displaced homemaker and they haven't been in school in 30 years, and their kids are now all in middle school and they're thinking, what am I going to do? Or perhaps a husband and father who lost their job, their factory closed down. They need an entry-level place to step into academics, to get a job, to be employed so that they can afford to continue to go to school. And so we encourage those students to go into our certificate program, which consists of only 5 courses. And that's a medical certificate program. You take those 5 courses and you are eligible to sit for the medical assistant certification. Not all places require that, but I'm a firm believer in certification. We can talk about that more as we move along. So it's something that we greatly encourage, and they're crying for medical assistants all over the country. You hear about it in the newspapers. There are dozens and dozens of ads. It's an entry-level position that most of our healthcare workers don't stay in for their whole career, but it's a good place to get your foot in the door. All but the final capstone course of that certificate program lifts directly into the next step, which is an associate degree called the Medical Coding and Billing program. So you get credit before you've even taken your first class in medical coding and billing for what you just got done taking. Now that's an associate degree, so the program takes longer. It requires 66 credits. Mind you, you come in ahead of the curve because you've brought credits with you from the certificate program. You complete the associate degree, and almost all of the allied health and bio courses lift then directly into the bachelor's degree. We have a bachelor's in health information management, which was just revised to increase the credits that you can take with you. So you end up with almost a third of the program completed before you've taken your first bachelor's class. And so then effort has been made to get students into an entry-level position and then hold them while they graduate from the highest level that they choose to go to, and that's career management.
That's just an excellent way of putting that, and a really good progression. We thank you for that. My next question is
Real quick.
Oh, yeah, sorry. Go ahead, Jeremy.
Sorry, I just had one quick announcement that I forgot to mention at the beginning of the broadcast. I wanted to remind our listeners that we are recording today's session, and a copy of this recording will be sent to you after we have finished today. Also, I want to encourage you, if you have any questions throughout this presentation, to feel free to ask those questions, which you can do within the questions or chat features within the GoToWebinar software that you have right now. So I just wanted to remind everyone of that, and then I'll turn it back over to Doug. Thank you.
Thanks. So Cheryl, the healthcare industry obviously has a shortage of candidates. How well are students educationally prepared when searching for jobs? I know you have mentioned that through your excellent example of the progression through our degree programs, but maybe you can elaborate a little bit more on that.
Well, I think one of the most important aspects to the entire healthcare field is the huge array of careers and positions and jobs that are out there. And as well as the growing fields, some of which haven't been invented yet. 10 years ago, for instance, nursing informatics and official case management didn't really exist. And now informatics is one of the fastest growing specialties in nursing. And of course, we have informatics in health, in allied health as well. So we have a broad array of choices that will position a student in the section in which they're interested in. And I use that word carefully, section, because even within that section, there can be a variety of positions that will be open that will be a little bit different depending on each individual job description. The degrees that are awarded are broad enough that a student would be academically then prepared to fulfill that position. Experientially, you need experience. Experience is hands-on, and you get experience when you actually get your job, and you get experience in performing that job. And yet narrow enough that you do have to pick, okay, it's so very different if you wanted to be a master's prepared nurse in an insurance company, for instance, which hires a lot of registered nurses, or Abbott Labs or Baxter, and they hire a ton of as a minimum, they have to be bachelor prepared. So a ton of bachelor prepared nurses that's going into research. I don't know if you realize this, but every drug that comes out on the market has a registered nurse behind it. They man all the lines, all the questions, all the incoming data and feedback from the physicians as it goes into mass production and distribution into the public as a whole. Those are going to be very different than somebody that wants to go into case management or somebody who wants to go to informatics. So you do have to choose, but within that, you're academically prepared to do a variety of things, and it works the same way with allied health.
Yeah, I just read a statistic that this is overall, but 85% of jobs that will exist in 2030 haven't even been invented yet. So
they haven't been invented yet, exactly. And we survey we survey the field of health, nursing, and allied health to see what's coming up out there. And we do have, as a long-range goal, the addition of some programs that I think are going to be up and coming areas. Our nursing informatics was one of the first programs for that. And one of the programs I'd like to pursue starting next year after we earn accreditation would be a master's um, in forensic nursing, because there's a shortage of physicians, and that trickles down into, you see all the CSI stuff on TV and it's really cool. Well, there's really doctors then that are supposed to be doing the autopsies and all of that medical examiner's report. Well, there aren't enough of those. And so they're starting to move towards specially prepared nurses. One of our advisory board members runs a business in for high-level forensic nursing. And so we do survey the field in an effort to see what could be a potential career in the future, and try to keep up with those types of changes.
That's great. I think Rayleigh's got a question for you.
I actually have a follow-up question. So you talked in the beginning about the entry-level worker that's wanting to get back in and how your certificate program would be good for them. But how do you see technology in the future and the automation of jobs? Doug talked about, how many jobs will be created, but what about some of those entry-level jobs in nursing? Do you see that any of those will be eliminated by technology?
I don't. We already see a vast shift in the in the infrastructure of how healthcare is run because of technology. But all that does is create another layer of need for healthcare workers that have the knowledge of that. For instance, there's a huge change in pharmacy and how pharmacy is run, particularly in acute care hospitals, which actually cost some pharmacists their jobs, which were just picked up by Walgreens and CVS, and so you certainly can get a job as a pharmacist, but it's all automated. We used to have people that pushed around carts and filled drawers, and that doesn't happen anymore. It's all automated, but what that did then at the time was free up the doctor prepared pharmacists to now round on patients. They actually do patient care. They show up on the unit, they go through every chart, they look at drug compatibilities, incompatibilities, lab works, they look at peaks and troughs for antibiotic drug levels for certain drugs. It's changed, but it's just changed the role in the spectrum. It hasn't changed the need for people. And that's what we're seeing. There will always be a need for healthcare workers to do hands-on patient care and take care of patients. You hear every day about the growing elderly. The fastest growing population in our country is the elderly. And so the elderly need more and more care. They come into old age with a variety of comorbidities, dementia, Alzheimer's, as well as physical comorbidities. Those people that would die 20 years ago from their heart attacks now live, but they end up with heart failure in their old age. So the demand for hands-on care will continue to grow. But what we will see is the insistence on better prepared healthcare workers that can use the technology, that have a knowledge of, for instance, the electronic health record. It's tough to find a hospital in America in this day and age that doesn't have an electronic health record. That was an initiative by the federal government, many years ago now. We haven't quite met that mandate. The biggest issue is that they don't talk to each other across healthcare systems. But within healthcare systems, Epic and Cerner and the big electronic healthcare records do speak to each other. And even housekeepers, you have to be able to use the electronic health record. All of their medical assistants document all of their findings in the electronic health record. So we are in the process and almost ready to roll out a course that upgrades our what we call CS 205, which is our computer, a healthcare computer course, so that we have a live virtual electronic health record system that allows our students a chance to learn and practice in our controlled environment with an instructor that is fluent in those healthcare records, so that when you walk into your first job, it's not like, I have no idea how to enter, a urine output or a blood pressure because I've never seen it before. So it's just a matter of us keeping up with the changes in the technology. It remains one of the fastest growing professions in the country, and it's expected to do that. It's projected to do that into the 2020s and beyond.
Awesome, thank you for that. So you did mention something about, the need for those caring professionals, especially with our aging generations. Can you sort of talk about the type of student or person, the personality attributes of a person that would do well in your program or that should be interested in your program?
No, we'll take all personalities. We really will, and I'm serious about that. One of my favorite stories, and y'all, I know I'm not just talking to nurses, and nurses, we tend to freak out people because we'll talk about anything, right? One of my students, after 9/11, when all the airlines folded, I walk into clinical, and it was this tall, beautiful blonde woman, and she's older. And wasn't my typical student, and so she came into my clinical, and she's ready to graduate. It was her advanced clinical. She was going to get her registered nurse degree, and I like to kind of get a feel for what it is that they're going to do, and I hadn't really had a chance to do that, and her patient required a suppository. Which, as you all probably know, a suppository is given rectally. And she's like running around trying to find somebody else to do this. And I caught wind of that. And I said, well, why are you doing this? She says, well, because I don't touch patients. And I kind of looked at her, I'm sure a little bit askew, and said, but you're in a nursing program. And she says, well, I'm going to go work for an insurance company. I'm going to work in my high heels and shoes that I have from the airline, and I'm never touching a patient once I get out of school. She passed. She got her registered nurse degree. She went to work in an insurance company, and she never touched a patient. I made sure she gave one suppository, though. I said, you're just going to have to suck it up and do this because this is a requirement to get out of my class. But, the point is there is no one perfect nurse, right? Do you have to be like warm and caring and kind if you're going to go in a nursing home and work with 90-year-olds with dementia? Absolutely. But if you're not a warm, fuzzy person, is there a place for you in healthcare? Absolutely.
Okay.
That's
awesome,
great.
thank you. That was a great story.
That was a great story.
So our student organizations and other resources, what are they? Can you tell our students?
We are in the process of developing a School of Nursing student organization. We've actually got a community room set up. We've got a doctorally prepared champion, not quite ready to put out the notice for the students, but it will be in the next month or two. So for future students, there will be a nursing organization, and our vision for that is that they will have a supportive role for each other, an educational role for each other, and a voice at the table for governance of the program. My vision of students is that when you enroll in a school, we have a contract with each other that you're going to do your best to be the best student and learn what you need to learn. And we're going to provide the best educational experience that we can possibly provide. And for us to be able to fulfill our part, we need to hear your thoughts. And so we're going to achieve that through our student association. Students already can come to all the faculty council meetings. They're posted. You're welcome. We have a student that sits on our advisory board committee, and we now have an alumni because she was our student who sat while she was a student, and she liked it so much that now that she's graduated, she has volunteered to be our alumni. So she comes back now with that wisdom that comes from experience, and is able to help tell us what things would improve our program. Once we get that up and running, we're going to be looking at doing the very same thing for allied health. So those are big processes for us to allow students a voice in student governance.
Excellent, thank you.
Can you speak a little bit, as the dean of your college, can you speak to any advice or encouragement that you have for that individual out there that's looking to get back into school and is interested in nursing? What encouragement would you have for that individual that's looking to get back into, that school environment?
Well, specifically to nurses, nothing will ever be as bad as your entry-level program, ever. I told that for over a decade to students because you have to go back to school. It just is. There's just no ifs, ands, or buts. You have to go back to school. Unless you are within 5 years of retirement, you need to go back to school for a whole host of reasons that I'll get into in a minute. But the worst thing that you ever have to do in your life academically is get your registered nurse license. It will not ever be that bad again. In fact, most students tell me that they thoroughly enjoy their bachelor's degree because that bachelor's degree also picks up liberal arts courses. The philosophy of the bachelor degree in this country is very different from your technical school that you went to. Your associate degree technical school is got a few things, like psych and speech and things like that. But basically, the technical philosophy is that you learn your skill and you go out and you get a job and you perform your skill. The bachelor's degree is that you become a well-rounded citizen. And that means that you take an arts class and a history class and science classes, and we call those our general ed courses and electives. We don't have a lot of them in the nursing program because there's so many other things we have to give you, but we do have a writing course, we do have a statistics course, and then we have things that were not covered in your entry-level associate degree program, or that were covered in 6 seconds in the Cherry book. If I got students that are pretty recent in the webinar, you'll be chuckling at the Cherry book because that's the 4th semester book for the whole world. We have classes on case management and leadership and public health and those kinds of things that you really didn't have time to learn a lot about in your entry-level program. But they're fun because you're only taking 1 or 2 at a time, and it's just the stakes aren't so high. It's not like you've got NCLEX hanging over your head. So it's way better than it was in your entry-level associate degree. Secondly, it's part of your career management. The movement has been and continues to be towards bachelor's degrees. They've been trying to make it entry-level to practice since I was in nursing school in 1979. Yes, it's pitiful, but that's when I started nursing school. Back then, they were arguing about the entry level to practice. All of these decades later, they're still arguing about entry level to practice. And it probably would not have changed except for magnet status. Magnet status came in, and as nurses, you will know this, is a voluntary certification that hospitals can get that shows that they support their nursing staff. Nurses are the largest budgetary expenditure that a hospital has, and so you're a big deal for them. And magnet status shows that they have the best nurses that are academically prepared, and magnet status has a goal of 80% BSNs. And we now have hospitals that won't take non-BSN students into their clinicals. It's becoming more and more of an issue. If you want to move on up into any other role, they want a bachelor's degree. So it's best now to get in there and get going and start taking your courses so that when a door opens, you're prepared to walk through it. What I consider a disaster is that we have this really good bedside clinical registered nurse that is working on an associate degree, and they are like tops in their field, right? They've specialized in surgery or medical or OB or pediatrics or critical care or recovery room or ER or whatever. And 8, 9 years have gone by, and then a door opens. You can be a manager of the unit. You can move on up into this role, and maybe your goal has always been education, but it's got a requirement of a bachelor's degree, and it bypasses you because you're not ready. We want you to be ready. Start now. Get your bachelor's degree. If you were 2 or 3 classes away and it was a bachelor requirement, they'd give you the job. Be prepared. It's coming. Some states are moving towards BSNs in 10. Some states are moving towards BSNs in 5. Those that haven't mandated it will in the future, in my opinion. It just is the thing to do. It's better for you. It's better for your patients. It's better for the profession.
I have to say that with talking with some of your students, they do say the nursing, just getting their nursing license was the hardest thing they've ever done. But you have some loyal students in your BSN and MSN program. They thoroughly enjoy taking classes here, and I've never seen such a thorough and loyal base of students. They really love going to school here.
And we hear from them. They keep in touch with a lot of their instructors, and I think that makes the difference. Is the instructors, and I will tell you, we have searched far and wide to attract and retain the best instructors that are out there. All of you have been in class with a crummy instructor. They either weren't motivated or they had no idea. They liked ground, and now they were made to teach online and they didn't like it and they couldn't really make the computer go or whatever. But our instructors, to a person, is passionate about what they do. They are experienced in distance education. They are experienced in our Blackboard, which is our learning management system. We meet regularly. They volunteer to do things. They are academically prepared. Every single one of our bachelor's instructors have master's degrees, and every single one of our master's instructors have doctoral degrees. And they are fundamentally prepared to teach the specialty that they teach. Our nursing informatics instructor has a D&P in nursing informatics. They're like really rare. So we're blessed to have somebody that understands nursing informatics. Our management and leadership instructor is a lieutenant colonel in Washington. So who better to teach leadership than a lieutenant colonel with a doctoral degree? So all of our instructors are, I feel, are special people that are devoted to their students, and you can see the difference in the education that the students get on their side. Very similar in allied health. When I want an allied health instructor, I require somebody that's working in allied health. And as a result, I have several PharmDs. I have doctorally prepared PharmDs. I have doctors of chiropractic out there. I have a doctorally prepared person in anatomy and physiology. So we have my medical coders and billers actually code and bill. They could go write books on coding and billing. And so I think that's what makes the difference in the quality of what the students get is what the instructors are prepared to bring.
That's great. We talked about the shortage of candidates, and you elaborated quite a bit on that. But my question is, do you, in the healthcare industry, has the culture changed?
Narrow that a bit for me.
Yeah, meaning like the day-to-day work life in healthcare administration. Has the culture really changed in a healthcare environment?
Yes, yes. I will add that I lived through that change. I stayed in critical care as a bedside critical care CCRN, and then as the clinical nurse educator for critical care for almost 30 years. They didn't change willingly. The culture didn't change willingly. The highest level of any organization or institution likes being there, but they were required to change, and they were required to change primarily by the Joint Commission. The Joint Commission, and every nurse that's on this call will know, because they will have heard about the National Patient Safety Goals. So for decades, they've been going through and picking out what they feel has contributed to the seminal report where 100,000 patients a year are killed or injured. That's been out for 20 years. Everybody's heard about that report. They still hold it up. And it's like, put it away. And put it away because the culture has changed. The culture has changed because Joint Commission and the Institute of Medicine and several of the big players have said to hospitals, your culture will change. And so it has. I was part of doing sentinel event examinations, what we called root cause analysis of deaths and near misses. And back in the day, before the culture changed, almost always somebody knew that something was happening that was detrimental to the patient and the patient's survival, and did not feel empowered to speak. So they would be in a surgical suite and they'd cut off the wrong leg, and somebody knew. But the culture was that they didn't feel like they were empowered to speak up. That hospitals are now required to remove that barrier. And so to do that, they've had to empower workers of all levels. And I believe that they've made significant progress towards that. So that if there's just a surgical tech, which is an allied health field, right? So if there's a surgical tech and they've marked the wrong leg for surgery, that surgical tech now feels empowered to raise her hand and say, or his hand and say, you're about to make an error. That's not the operable leg. And I think there's been great strides towards that. The other culture shift that was enormous was the errors. And when I was a young nurse, if you made an error, you would get disciplined and it would go in your record. True story. The Joint Commission and the Institute of Medicine came along and said, that just means nobody's reporting any errors. If a nurse or an allied healthcare worker, any healthcare worker, reports an error and it becomes a punitive thing, they're not going to report any errors. And the truth of the fact is that most errors are a process problem. And so when that shift changed, it was an enormous culture shift, because then people felt empowered to step up and say, I made an error, and we didn't blame that person. We then looked at the process that contributed to the error, and we have made thousands of changes, some big, some small, some minute, that have now changed processes that enable our healthcare workers to practice in a safer environment. We now cross-check things, through the computer. That's the rise of the technology, right? And so, yes, I think that there has been, surely there's more room to grow, but there has been a change in culture to respect every single person that's in the hospital, whether it be the patient or the worker, and to allow them to have a voice and to be a part of the process.
Well, you just touched on it a bit here, talking about the rise of technology, and we talked about it a little bit earlier, but, we have seen a change in many industries. I would like to ask your opinion on where you see the healthcare industry going in the next 5 to 10 years, including both nursing and the allied health students.
I think we're going to continue to see the new positions crop up, and that's why I'm excited about the allied health program. We have a BS in health information management and a master's in health systems management, because the technology explosion is really behind in healthcare, in my opinion. I don't think we use a fraction of what's available out there in the private industry, probably because it's expensive, and health hospitals struggle to make money, whether people believe it or not. The community not-for-profit hospitals don't make any money. And so we're behind. And when we start catching up to that technology curve, there's going to be a huge demand for people that can bridge that gap. One of my favorite things to say is that computer geeks don't speak nurse, and nurse don't speak computer. So when they tried to bring in the first of the electronic health records, it failed. I worked at several hospitals that brought them in. They spent hundreds of thousands of dollars, and a year later they were gone. And that's because they weren't very bright at how they rolled it out. The next phase brought in the nursing informatics and nursing informaticists, the allied health bachelors of health information system students, graduates, speak both computer geek and healthcare worker. And that person is going to be looking at a job explosion, in my opinion, because the technology is going to continue to be introduced. What they have is going to continue to expand in its complexity and its abilities. And there's going to be a big need for that person that can bridge that gap between nurses who don't speak computer and computer people that just do code and have no personality skills to deal with nurses. That's where those people are positioned. And we have several programs that feed right into that level that I think will be very well positioned for the growth in that area.
I have a follow-up question that sort of relates not specifically to this last question, but we talked about, the industry trends and growth. What is your advice for those individuals that are living in a very rural area right now, and then also wanting to get involved in the healthcare industry, but there may not be that opportunity, or maybe there is and they just don't know where to look near them?
I think nurses in particular, but also allied health in general, have a much broader reach than what you would think. There are very few areas that don't have access to some sort of healthcare facility organization of some type within travel distance. And in addition to that, you have to look outside of what you would think your field is in healthcare. Again, research facilities, insurance facilities, all of those claims adjusters, they're not nurses. But if there's any issues and for approval, they get funneled into nurses. Nurses have huge case loads for that. Free clinics, walk-in clinics, freestanding clinics, telehealth. I don't know if some of you might not have had, maybe you might not be old enough, but trust me, when you get old, your insurance company keeps sending you notices to get tested for this and to get treatment and education and advice on diabetes and high blood pressure, because they're trying to save themselves some money, right? If they keep your blood pressure down, you won't have your stroke when you get older. If you keep your blood pressure on control, you won't have all of the complications of diabetes. Those lines are all manned by healthcare workers, not necessarily nurses. It depends on the level of the program that is involved. Some of them go right into nurses to try to keep them out of the emergency rooms, right? Because that's the highest level of expense in healthcare is the emergency room. So they have call a nurse. That's obviously a nurse. But some of these other lines are healthcare workers with different degrees that look at the computer programs. So I think there's going to be a growth in the virtual world as well, because that's what patients want. Patients want to have access virtually so they don't have to get up and drive 60 miles into the doctor when they're sick, right? I see that as a great frontier that has just now started to open up a little bit, and healthcare workers will be positioned well for that. Past that, if you feel like you're looking for something that has to be drivable, then you need to look very creatively at what's out there. In the colleges, do you have a technical college? Most technical colleges have a nursing and allied health department. They hire people to work in their skills labs, to work in their simulation labs. If you're a bachelor's degree nurse working on a master's degree, they will hire you frequently to do clinicals in the clinical setting. So I think you have to be creative in where you look, and that's where Doug's department comes, because that's what you do, right, Doug? You help them look at their career management options.
You bet, yeah. We enjoy doing that, and especially working with your departments.
Every now and then we have to play devil's advocate and ask how to find it. Yeah, but if you're a student and you're needing help with finding those opportunities in a rural area, yeah, Doug or the Career Services Department can help with that for sure. But as Cheryl just talked about, we have opportunities available. You may not think that there are, but you just need to look at it creatively, and that's what we help the student through in the Career Services Department.
Well, hey, my last question is, can you speak about the accreditation to the department? I know there's a lot of things that are going on right now and possible things in the future.
Yes, I'm happy to. That's an important aspect of it. Accreditation is very confusing for potential students. And if you're looking at going back into a program, you need to know about accreditation, and you need to consider that when you pick a program. There's lots of things that I would look at to pick a program. The length of the program, the number of credits, the price per credit, to me, faculty is a really big deal, so I always look at, what type of faculty. I look at their bios because those are posted online, and I want to know that they're hiring top quality faculty. I want to know what the student the student approval rating is. We do end of course student surveys. And when we collated those, and I don't remember what the masters were, but I remember the bachelors stuck out. We collated those for all of 2017 for every single course where a nursing student filled out the end of course survey, and it was like a 96.6% approval rating for those courses as a program, which is phenomenal. So I look at those kinds of things. But you also need to look at accreditation. First and most importantly, the university needs to be accredited itself. The university has to be accredited. Grantham University is fully accredited through DEAC. DEAC is our accrediting organization, and it has full approval through the federal government. We actually are a financial aid eligible institution, which requires a whole level of approval from the government to be able to distribute financial aid. Then you need to look at programmatic accreditation, which is a whole different thing. You don't have to have programmatic accreditation to have university accreditation. The major players for programmatic accreditation for nursing is ACEN, A-C-E-N, and CCNE. ACEN is by far the larger. They have over 1,300 programs. They've been in existence forever. They just achieved a flawless reaccreditation from the federal government itself, and they are actually an independent financial aid gateway as well, though we would not use them for that. CCNE accredits over 700, I think now, thereabouts. So it is also a long, well-established accrediting organization. The primary accrediting organization for allied health is AHEM. Allied health is much more difficult because there isn't just one agency. I'm going to be working on accrediting allied health programs beginning next year when we get nursing done. But with nursing, we just chose an accrediting agency, one that we thought would best fit our needs. And we're going to accredit everything. We're going to accredit the RN to BSN, the RN to MSN, and all 4 master's tracks. With allied health, I can't do that. I'm going to need to pick off the programs and then ascertain which accrediting agency we feel is best for the students in each one of those programs. So that'll take me a little bit longer. But essentially the process would be the same. So for nursing, we achieved candidacy status for ACEN, ACEN, in fall of 2016. It's the only accrediting agency that has a candidacy phase, and we chose that because we wanted to make sure that we did absolutely everything that we needed to do to make this a best-in-class, state-of-the-art, innovative program. And we have taken every minute of those 2 years to revise everything. And our site visit is scheduled for October 9th, 10th, and 11th. We're excited and nervous all at the same time. They calm you down, and they quote us the statistics in that in 2017 they did initial accreditation for 46 programs and 45 earned accreditation. So that's a pretty good thing, right? What that means is that if they give you candidacy, they're pretty sure that you're going to be prepared to earn full accreditation, though there never are any guarantees. So we have made many, many changes to assure that we meet everything that the accrediting body will require of us and hope to earn full accreditation in, well, they give us a report after the site visit, so that'll be in October, but it'll actually be in 2019 before it finishes going through their process and we get the official letter that says that we're accredited. Any student that is active during the time of the site visit for nursing, which is October, will be considered to have graduated from a fully accredited program. We feel that's very, very important for our nursing students. Because of the Joint Commission accreditation and all the different accreditations that the nursing homes and SNFs and rehab centers have, healthcare is all about accreditation. It's a standard that you've met the requirements of the profession. And we want that accreditation, and students need that accreditation, and we consider it our responsibility to earn that accreditation for you. Having said that, you are a part of the process. We need student activity. We need students to fill out surveys. The accrediting site visitors who will be on site in Lenexus, Kansas, will be wanting to talk to students. We'll be interviewing students about your current experience in our program. And so that's our short-term and long-term plan, is to get all of nursing accredited in one fell swoop, and then we'll be beginning to turn our attention to the different programs in allied health.
I just have a quick comment because this is a topic that we do have students ask this question on. We are accredited as an entire university, and what the nursing school is going for now is programmatic accreditation, which I know you mentioned, but I just wanted to re-emphasize that point.
Yes, absolutely. The school has been accredited for a very long time.
Since the 60s,
Yeah.
much. Yeah.
Yes, yeah. The school is very well established. It's got a solid foundation. It started out with more of a military focus, and I will tell you that though the military focus remains and is strong, we are a school for everybody. the vast majority of our nursing and allied health students, are not military students because we offer what the general student needs. We have a reasonable amount of credit. We have good solid programs. We have instructional design teams that design our course rooms. We have one of the most, we make the lists of the most reasonably priced universities in the country on a regular basis.
Very true. Awesome. Well, Cheryl, we really appreciate the information that you've shared with us today, everything from, the industries, the expectations of the degree programs, and even, looking towards the future. And just to finish out, I think I asked you this the last time we got together, but as the dean of the school, I'm curious to know what final thoughts or general advice that you would provide for our students at the various stages that they are. So we've definitely got some students that are considering the program. We've got students that are working their way through the program, and of course, we've got students that have either, are on the verge of finishing or have just finished. So what's some general advice you might share with those individuals?
Grantham University is an open enrollment university. What that means to potential students is that we don't just take the 10% at the top that many universities take. You've probably heard about how difficult it is to get into some universities. Even there are many universities that say that they are open enrollment, but if you don't have this score on the ACT or that score on the ACT or a certain grade point average on your prior transcripts, you're not going to get in. The philosophy of Grantham University, when it started, as you said, all the way back into the 1960s, actually goes hand in hand with this. I live in the state of Wisconsin and progressivism, where they sent the whole state to school. They believed that every person that wanted an education was deserving of an education. And that's the philosophy of Grantham University. So we have an open enrollment school. Being an open enrollment school puts a certain level of responsibility on the university to be able to support those students that perhaps aren't truly academically prepared to go back to school. Everybody deserves a chance. And so if you're willing to put through the work as a student that maybe wasn't the best high school student or that's been out of school for 20 years, then we're willing to put in the work on the other side of the equation to support you. And I can tell you that for nursing, and some of these processes exist in allied health as well, we have a whole host of things to help you be successful. When you take your first class, you are assigned a mentor that helps you with the capstone project through the whole rest of your program. You develop a relationship with this person because you're there with them, whether it takes you a year in the bachelor's program or 2 years in the master's program. They're an assigned mentor that stays with you. We have a request a mentor feature. So you go into what we call the Global Village, which is all student facing, and it's full of everything you could ever want to know about the nursing program. We'll be setting up something for that with Allied Health, hopefully by the end of the year. And you can just simply send in a little request for a mentor. You tell us why you want a mentor. Maybe you're a male nurse and you really want to know what you need to prepare for to be a male nurse with a master's degree. I have a doctorally prepared male nurse that we can assign that person as a mentor to you. Maybe you are a military student and you're struggling with PTSD and getting back into the swing of things coming up out of active duty, and you just need to reach out to somebody that you know understands. I have our lieutenant colonel that I would assign as a request of mentor. We have so many processes set up to help you come back to school that my fear is that something will stop you from doing so. Whether or not you feel you can't do it, whether or not you feel you're not prepared, I would feel bad if that happened. Reach out, let us show you what we have to support you, and come back to school.
Great answer. I love it. Yeah, and and that's one of the things I do personally love about Grantham University is that there's a whole team or host of resources and individuals that are here to support the students. From the first conversation that you have with admissions reps, to the student advisors that guide you through the programs, and even our department in career services, who will help you, for your next steps. I definitely wanted to highlight Doug Dimler again because Doug does work with our students within the School of Nursing and Allied Health and Career Services. So he is definitely the go-to guy to talk to, if you have questions about, some of those things, that you need to prepare for, interviews, resumes, things of that nature. And Doug works regularly with Cheryl, to help, get her perspective and her guidance on those issues as well. So if there's any questions that anyone has to that nature, definitely reach out to Doug and he'll be glad to assist you. The last thing I definitely wanted to let everyone know about is our Career Launch program. This is a great comprehensive and self-paced program that you can participate in. There's no cost to participate in Career Launch, and it's going to give you all the career management tools that you need, from establishing your career direction to drafting polished resumes and cover letters, honing your interview skills, salary negotiation, and much, much more. And we definitely would like you to take advantage of that. So if you are interested, just give us a call here at the number that's listed, 1-800-955-2527, extension 173, or you can just email us at careerservices@grantham.edu, and we'd be happy to talk to you. But again, Cheryl, we really appreciate you joining us today, and just want to thank you for the great information that you shared with us.
It's my pleasure, Jeremy.
All right. Okay, well, that's going to do it for today, and we look forward to chat with you guys soon. Thanks, Ed. Thanks, everyone.
Bye-bye.
Bye-bye.